Okay, so can you hear me okay? We carried out a 360-degree evaluation of the simulation. So we wanted to engage with all of the relevant people that were involved. So the first thing we did was to evaluate from the student perspective. So that was the students that Anne referred to in terms of the students that were observing the simulation and then the 3 students that were immersed in the simulation. We also evaluated the perspective of our simulated persons, so our actors. So that was our patient and her husband in the nursing home. And then we also had feedback from our clinical partners, our specialist palliative care services, and academic faculty staff. So I suppose it was very useful to do it in this way because then we got a really nice balanced understanding of what, the effectiveness or the impact of the simulation really from all of the different perspectives. So in terms of the results, well, the results, they were overwhelmingly positive. We asked questions in the evaluation around 3 key areas. So Anne mentioned the pre-brief. So the pre-brief was overall positively evaluated. Now we know it's really important to simulation in terms of supporting students to be really clear in terms of what their expectations are, from a psychological safety perspective. So it was positively evaluated. However, a minority required a little bit more information and aspects, such as the time points, supposed to give them further direction, encouragement, and so that they were very clear on what the purpose and objectives were. The simulation itself did increase, the students reported that it increased their confidence, it increased their understanding in what palliative care need assessment is. And they felt better able to respond to those changes in the patient's condition during the simulation. They also said that they had increased confidence in their communication. So that was really good because Anne referred to the aim was to try and improve those competencies and confidence levels. So that was really good for us to hear. In terms of the scenario itself, in terms of authenticity, the students did feel it was authentic, they felt it was realistic, and we really have the specialist palliative care services to thank for that because they were key in developing this scenario. Some of the descriptors that were used in relation to the actual simulation event were that it was emotional, powerful, an enlightening experience, and there were some nuances observed in terms of the how the student addressed the patient and her husband, the level of eye contact that was maintained, and some in terms of the explanations that were provided. So that was really highlighting the importance of the sensitive communication in that context. So we were very, very pleased with that. In terms of the debriefing session, or that conversation that we had with the students afterwards, they did feel it was constructive, and they felt it was supportive. That we talked about what worked well, maybe how performances could be improved. But the most positive thing from the debriefing session again relates back to the input from our clinical partners, because we had the specialist palliative care services there. They were able to support that facilitation and that discussion. And there was a lot of discussion in the room, and there was really opportunities then even there for further learning. And the team were happy to share their experiences and their knowledge, which really helped then the students to align their theory with their practice. So that was good. So overall, it was a very valuable educational strategy. It has informed programme development and leads out in this programme. She does a great job, and we're delighted that it's now gone to a level 9. And so simulation is firmly embedded within the level 9 programme. We're continuing to review the scenario in collaboration with our clinical partners, the specialist palliative care service, to make sure that it remains realistic and authentic. But overall, there has been enhanced student learning. We could see that in the evaluations. You could see it in the debrief, you could observe it in the simulation, you could see the confidence levels growing as they were moving through the 3 time points. So it was observable. But I suppose, despite we're sharing all these very positive outcomes with you in relation to this, you know, there are questions remaining about the long-term impact of this on clinical practice. And what we really want at the end of this programme is, you know, that students will exit it and will go forward into their practice and actually undertake the palliative care need assessment. So we do think that there needs to be more research, you know, to explore and to evaluate this further. So thank you.